Welcome back to part 4 of our lecture. This is officially our longest lecture now, but I promise we're almost done. We only have 3 slides left. So, heart scan. Specialized type of computed tomography, CT, called an electron beam tomography, an EBT heart scan. It's a screening tool that allows physicians to see the amount of plaque in coronary arteries by showing the presence of calcium deposits. Physicians assigns the patient a calcium score that can be a predictor of future cardiac problems. So calcium makes up approximately 20% of the arterial plaque deposits. The heart scan takes less than 5 minutes and does not require any needles or injections. So that's nice. It's a very convenient scan. So we always end talking about our patient education and our legal and ethical responsibilities. So patient education. It's important to talk to the patient about factors that can be changed or modified and encourage any attempt by the patient to make these changes to reduce risk of cardiac disease. Visual aids can be used like brochures or posters. Also, a lot of times we will have, especially if you're in a cardiology department, you might have models of the heart and different models that show blockages and things like that that you can use as visual aids. No educational items used with the patient in the medical record so that it's possible to see next time and the time after what has been used and discussed so that you're not just repeating yourself over and over using the same educational items. On subsequent visits, ask about the helpfulness of the information that they were given and whether the patient tried any modifications, and if so, what the results were, so that you can kind of track with them how they're doing and if some of those modifications are helping or if they see differences. So legal and ethical issues here. We have an ethical obligation to complete the EKG as accurately and as carefully as possible. If we do not do this, we could miss very important information that could lead to death eventually. Also, you assume full responsibility for the accuracy and precision of each test you perform, which means that you used all the information that you knew, you looked for the artifacts, you did everything correctly, and that is fully your responsibility to do so. The results you submit strongly influence each patient's therapeutic treatment plan. So it's not something to take lightly. You want to make sure that you understand and do everything correctly to the best of your knowledge and skills. I hope you found this interesting. It's one of my favorite parts. I love learning about the heart and the EKGs, and when you actually get in the lab and do the EKGs, I think you're going to really enjoy looking and starting to interpret them. If you have any questions, again, you can post it on the question and answer board or bring them to class with you on Tuesday. I look forward to seeing you. Thanks for hanging in there today, and have a great day. Bye-bye.